Hey everybody, we are back with Candid Convos with Nurse E, and today I have the pleasure of conversating. Oh, you know what? I was corrected on that. I'm not supposed to say conversing with Dr. Herold. This is Dr. Joyce Herold, and I have come to know Joyce through a mutual vendor. That's how we met, and it's just kind of soared from there. So I know the Joyce that's a part of a amazing chiropractic firm out in Harford County, Bel Air, Overlay area. I know the educator, I know the minister, I know just a superb mom, all the things I know. And I want you guys to get to know her today in our conversation, but I'm going to stop there with how I know her, and I'm going to just let her introduce herself to you guys.
That's always the $1 million question. So I'm so happy to be here. Thank you for having me.
Yes, I'm happy you're here.
It's truly important, the work that you're doing.
Yeah.
So to be a part of it is a beautiful blessing.
Thank you.
But yeah, I'm Dr. Joyce Herold. I am an executive at MSI Integrative Healthcare, which is a health organization which the parent company of MSI was started in 2007 by my husband and I.
Okay.
With a grand mission to help people from an integrative health standpoint get better with the most effective, non-invasive and minimally invasive health options in the world.
Yes.
And so we've been doing that for almost 20 years now.
Wow.
And so, but as a person, I'm a mother, I'm a wife, I am a child of God.
Yes.
And all the things, right? We get to be all that God has called us to be. And so I'm living that dream out right now.
Yeah.
And so I'm happy, but professionally and from the lens that we'll be talking today, I am a healthcare executive. I am a community health person with deep roots in helping people, communities, regions get better and stay healthy so that they can live out their God-given potential.
That's great. Now, what I guess I should probably wait to ask that. So let me first introduce kind of what we're going to be talking about today, and then you can define what a health executive is. Okay. So you guys are probably not aware, but what month are we in? We're in October. So October is Health Literacy Month. And you probably are like, what the heck does that mean, Nurse E? And I'm glad that you asked, because that's what we're going to talk about today. And the fact that you don't know, I don't care that you don't know that it's Health Literacy Month, but maybe the fact that you don't know what health literacy is what we're going to break down to you today. This conversation is going to be amazing because she knows so much about this topic. So before we get started, let me define what health literacy is.
Okay.
So health literacy is the ability of an individual to acquire, understand, and use information to make informed decisions about their health. So basically what was in your intro, right? When you were introducing yourself. It involves understanding medical terms, navigating healthcare systems, following treatment plans, and engaging in behaviors that promote well-being. Okay? Strong health literacy. We want to make you guys strong. Okay? Strong health literacy helps individuals communicate effectively with healthcare providers, access services, and take appropriate actions to maintain or improve health. Is that not the definition of the foundation of MSI?
It certainly is, because we firmly believe, not only as individuals, but collectively. So everybody that becomes a part of the MSI family really believes that the better you can equip someone with information and resources, the better they can take care of themselves overall. Because, we may have 30 to 45 minutes, maybe an hour for an exam, when somebody's coming in for therapy and treatment, and then they have the rest of the day and the week to themselves. And so what you do at that time really does matter for your overall wellness and health and well-being, because we want to be healthy.
Exactly.
You know, we want to do the things that we enjoy and that we're called to do. And we want to feel good doing it.
Exactly. Yeah. So you guys, with health literacy, one of the biggest components that I wanted to pull out of health literacy is understanding your health insurance, your medical health insurance, okay? I work with a lot of clients that just don't have a clear understanding of how to use it, what they're paying into, why it doesn't cover everything. And so that's the specific topic that we're going to break down today, okay? So let's talk about the three of the main big insurance companies. So we've got Blue Cross Blue Shield, we have Aetna, and we have United Healthcare. You are usually offered insurance benefits through your job, okay? And to be quite honest with you, that's how some people choose whether or not they're going to work for a company or not, based on, hey, what do the benefits look like? Benefits that they don't even use. Maybe but twice a year.
Right.
But paying a premium into it. And have all of these expectations that they fully don't understand. And unfortunately, human resources and different departments don't fully explain. Because I wouldn't even be talking about this if you guys had a better understanding of it. You know what I mean? So Blue Cross Blue Shield, United Healthcare, Aetna. We're just going to use those three. They're pretty famous for healthcare benefits through your job. And so usually when you have healthcare benefits, that means that you can go and see a provider in different arenas. So your primary care provider, if they refer you to a specialist like a orthopedic, if they refer you to physical therapy, your insurance allows you to go there and not have to pay a large sum to see them. Now, you may have to pay a copay, which is usually $30, $50, and the copay represents a specific payment that is going to be given to this specialist. This is outside of your premium that you already have to pay, your monthly premium that you already have to pay. And if you have an employer, usually they pay half of the premium and then you pay the other half of the premium. And based on your health insurance, they dictate to you who you can see. In-network people, out-of-network people, okay? And so with being a healthcare executive at your practice, what has been your experience with clients and them understanding their healthcare benefits?
That's a great question. So a lot of times, and I had this view too, before I started working in healthcare and understanding the landscape that we're a part of in American healthcare. So a lot of times we as consumers for health insurance, and remember, health insurance is just like any other insurance.
Okay.
The actual company itself is weighing the risk of you getting sick and them having to pay out a larger of a sum of money to benefit you as you are recovering from an illness or some unforeseen circumstance. They expect to pay out certain things that are preventable.
Okay.
Right. And that's why a lot of times when you go to purchase insurance, health insurance, it's based on your age.
Yes.
Right. So you pay a higher premium the older you are because the risk of them having to pay more out for your health care is increasing as you're getting older. Right. As we get older, we need more care. Right. Things start hurting. Right.
Now, you need more care if you don't practice preventative wellness.
Well, just generally speaking, right?
Okay.
Generally speaking, you know, when I'm in my 20s, my 30s, right? I don't even need a mammogram yet.
You're right.
Right. So
it's a screen.
Even when you are preventative, you know, now that I'm in my 40s, my mid 40s, I do have more preventative health doctor's appointments.
Yeah.
So your health insurance carrier is weighing the risk that it takes, there is the probability of them having to pay out more or less for you.
Yeah.
But to answer your question, what I've seen in the healthcare arena is that a lot of times people view their health insurance as, you know, dare I say, a savior. Right? This is my savior. I'm going to use my health insurance to take care of myself.
Right.
And that's it. And that is just not how I would recommend or even a best practice in terms of taking care of your overall health and well-being. What I like to share with people is to consider your health care as a pie chart.
Okay.
And you determine the types of needs that you have as a person. And then you purchase health insurance that is going to help you meet those needs. It's not going to cover everything because it will cover, you know, some preventative health, doctor's appointments, your primary care provider, your women's health provider, things like that. Some emergency visits if you need them sometimes. But not all policies are the same. So you're going to purchase the closest you can to what values you have and the needs that you have. And then you want to probably save some money for some things that are not going to be covered, no matter how much of a great insurance policy you have. So massage therapy, chiropractic care, some regenerative therapies, some muscular hydration, things that, you know, really do help and really do help sustain overall wellness, right? Sickness and chronic illness prevention.
Right.
And so for me, I'll tell you right now, my health insurance probably attributes to 50%, maybe a little less than what I invest in my overall health care. It is not everything. It's not even the majority.
Right.
I pay, in addition to that, I save money in an HSA to use for things like massage therapy, extracorporeal shockwave therapy, human cell and tissue products for aka stem cell type of things.
Now, what does HSA? Because you and I know what HSA means, and some of you guys may know what HSA means, but we are talking about health literacy, so I want to make sure that you are. Absolutely. What does that stand for?
So HSA stands for Health Savings Account.
Yes.
And so that is where you can put money in a savings account that is specifically allotted for your healthcare needs.
Okay. Now, can I ask a question?
Yeah.
Would you recommend someone who's in their 20s and 30s to invest more into that account, have a lower premium, higher deductible, more money in the health savings account because they can kind of move and direct the way they want to go as far as preventative medicine? Do you recommend that?
It depends. I would say if you have a chronic condition or acute condition, so if you have something that you're dealing with and it's not going away, or you know you have some type of long-term treatment that you need to dive into, then that may or may not be an option for you. But in terms of young, healthy folks, your premium is going to be lower anyway because you're young, and the premiums are lower for the younger you are. So you got that on your side.
Well, I think, I don't know how low, because I didn't pay attention to my insurance at that age. So I don't know exactly how low. You probably know more roughly the numbers. But, they have student loans that they have to pay.
Yeah.
If they've got a car, they got to pay a car note. They've got to pay car insurance. If they no longer live with their parents, they have to pay rent. So we want this to be as low as possible for them. Like $200 may seem low to us. That may seem like a lot to them. You know what I mean? So I think that's all the more reason why it's important for you to do preventative measures to take care of your health, because the more you do preventative measures, the less likely you will need, if you don't have a chronic illness. Chronic illness is like an asthma, diabetes, any kind of heart diseases, kidney diseases, if you don't have that, it's most important to start doing preventative wellness so that you don't get to chronic illness.
Yeah. So as a young, healthy person, it probably is a good idea to get a lower cost, like a lower tiered
Yes.
insurance policy.
Because they have gold, silver, bronze.
Right. However, and that's why you really do need to sit down with your HR representative, or if it's not through your employer, sit down with the broker that's selling you the insurance, and just have a conversation about what's covered and what's not. Because a lot of times you still want to have you want to go to your preventative doctor's appointments, right? You want to see your primary care once or twice a year or whatever the case may be. Your OBGYN, your gynecologist, right? Even your dentist and your for your eyes, you want to go to those doctors annually. You don't want to skip those.
Correct.
However, those lower tiered policies, often your copays are not covered, are not paid by your insurance company until you meet your deductible.
Exactly.
So you really do need, so if we want, I think it's probably a good idea to define what some of those things are.
Yes.
So that people will know what is a deductible,
right?
What's a copay, because a lot of times you have a copay on your policy, but it may be a caveat in the policy that for the lower tiered policy, the one that you're paying the least for, you have to pay a deductible. You have to pay a certain dollar amount before your insurance policy will pay anything.
You're right.
For your care.
So what can you define deductible? What is a deductible with your healthcare insurance?
Yeah, so some terms that are very common that you want to definitely know is you want to know what your copay is. You want to know what your deductible is. You want to know what your coverage is. And what your out-of-pocket max is.
Okay.
All right. So your copay is your patient responsibility that you have to pay to your health provider for a said visit.
Yep.
Right. For a service. Sometimes it'll be that copay will be a set amount. Okay. Depending upon the policy that you purchase, you will either have to meet your deductible, a certain dollar amount, or you don't have to meet your deductible before that copay will be applied. Okay. So what that means, so let's go to deductible.
Okay.
So your health insurance, again, it's insurance. They're saying we're going to give you a certain amount of coverage in the event that you are to get sick.
Yeah.
Okay. And so policies that you purchase come with a deductible. Okay. Your deductible is the lump sum that you, the patient, are responsible to pay toward your policy before your insurance company will pay anything.
You guys, this is outside of your premium that you pay every month. This is outside of your monthly premium that you pay every month. You have a deductible. And deductibles can be $100.
Yeah, for example, I have a gold policy with my insurance carrier, and my deductible for my individual self is $3,500.
Yeah.
So, but in that gold policy, even though I have a deductible, I can still go see my doctors and only pay $35 for those preventative health things.
Yeah.
However, things that are outside of the preventative realm, like your primary care provider visits or your specialist visits, those are whatever the copay is, just because I pay more for health insurance, so my deductible does not apply. However, if I go for an MRI, or if I go for an emergency room visit, both of which happened to me this year, I do have to pay whatever the contractual agreement is That is the value of that visit, the cash value of that visit. I have to pay that out of pocket. And that goes toward my $3,500 that I have to pay for my deductible. So that's what a deductible is.
But usually when you make that payment, that is billed to you after they do the test, or do you have to pay that up front?
It depends on the doctor's office.
Okay.
A lot of larger companies that see tens of thousands of patients a year, they don't have time, to bill you up front. A lot of times they don't know what it will, but it just depends on the practice, the financial practice of the institution that you're going to, because sometimes they will look it up on the website and give you an estimate, and you'll pay that at the time of service. And sometimes they'll bill you later. But that is up to the provider. So you do have to have cash on hand when you're going to your doctor's offices. It's just like going to the grocery store. You don't go to the grocery store and say, hey, I'll pay for these groceries later.
Right.
You're providing a service.
Right.
And, you're financially responsible if you are going to be purchasing those services. So what is an out-of-pocket max? An out-of-pocket max, if you have an out-of-pocket max on your policy, that just means that if you're going to be paying, it's the lump sum, the grand total, after which you have to pay nothing else.
Right.
So a lot of times it's a lot of money. It's like $10,000, $12,000. The probability of people paying that out over the course of a year of this policy is like slim to none. But
unless they're really sick.
Unless they're really sick. And so that's why it's in there for people who are, dealing with illnesses that are very expensive. And so once they meet that grand total, they don't pay anything else. But I skipped one by accident. I'm sorry.
No, it's okay.
I skipped co-insurance by accident because a lot of times those are confusing. I've seen this a lot in the healthcare insurance arena where people don't understand the difference between a copay
and co-insurance.
So a copay is a fixed dollar amount, which is your patient responsibility.
So for example, $20, $30,
$50. Yeah. Co-insurance is a percentage that you're responsible for a said visit or service.
Right.
Okay. So that is going to be variable because not everything that you purchase is going to be the same
price.
The same price. And so, for example, you may be financially responsible for 20% of your visit, 50% of your visit, or 80% of your visit. Yeah. And so if you have a co-insurance, it's going to be a percentage of you financially that you're going to be financially responsible for. Yeah. So I do have to say, viewer,
my
people out there, wonderful people, amazing people, that health insurance, this policy is not designed to be intuitive, is not designed for it to be easy to understand.
Right.
If it were, then we wouldn't be doing this deep dive into it. Because what we've learned as healthcare professionals is that it's not easy. And so the more you can equip yourself, the more you can actually put, what you truly believe about your health, because your health is your most valuable wealth. You can put that knowledge to action and start advocating for yourself. You see my Dare to Live Well? It takes courage and it takes some grit to be able to become well-versed in your health insurance and use your health insurance as a portion of how the overall landscape of how you take care of yourself. And so these are really important terms.
Yes. And it's so funny because I had a family member give me a call this week. They had some testing done and they wanted to know, what do these terms mean?
Yeah.
So they called me.
Yep.
But what if you don't have a family member that can explain to you what the terms mean? Google is not Dr. Google.
Right.
Okay. You do need a health professional that to help decipher this information. And I think it also takes some type of humility. We don't know everything.
Right.
I don't know everything about what you do. You don't know everything about what I do, but we can work together to gain understanding, and so that's why I so badly wanted to talk about health literacy. And when I thought about the topic, I was like, I know the perfect person who is just passionate about health,
Yeah.
passionate about education, passionate about people being informed.
Well, you mentioned your loved one. The one of the reasons, and a lot of times when we're passionate about something, we got to kind of go back to the root of the thing, right? And so one of the reasons why I'm so passionate about quality healthcare is because, my mother passed away from stage 4 lung cancer at the age of 44 when I was 21 years old. And so she was misdiagnosed. Okay. I saw the series of testing, and nobody would sit and talk to us about exactly what was wrong. Because people were scared to tell her she was going to die. That's what I gathered. And so, we have these health experiences, and we can either run from them or we can face them head on and dig deep and get the courage to really forge the life that we want to live.
Yeah.
And, I've had surgeries, I've had, broken bones, I've been in accidents. I've had a life that is, that's not without its trauma in terms of physical trauma. But I also have a wealth of knowledge on how to take care of myself post-trauma, because it's not about when you're going to have an issue.
Yeah.
It's not about if you're going to have an issue, rather. It's about when you're going to have an issue.
Right.
And so you don't want to be playing catch up when you face something.
Right.
You want to get the education and the resources now so that you're equipped and prepared and confident that you are the contender to battle whatever you're facing.
Exactly.
Yeah.
And I think, with health insurance specifically, it's like, oh, well, I'll just call and see what providers are listed, which that's fine, guys. I don't mind if you do that kind of stuff, but it's also you want to research, that provider that you're going to be working with. Will they sit down and will they talk with me? Will, how long will my visit be? Will they listen to my complaints? Will they refer me to the right people that I need to meet with in case there's other situations that are going on? Are they going to constantly follow me through the end of whatever the disease process is or sickness, whatever the case may be? You want to, when you're paying healthcare insurance, you want to know that your provider is invested in you.
That's right.
That they're invested in you, that they're going to take time with you, that they're going to treat you like a person, not like they're herd cattle or sheep.
Yeah.
Okay. So that's why we want you guys to be fully informed about healthcare literacy.
Yeah.
Also, too, they give you instructions. They give you a prescription for a new medication. Yeah. Are you just going to trust what the pharmacist says, or will you be able to read, okay, this is what this medication does. These are the side effects. This is what I need to do. I need to take it 2 hours before I eat, 2 hours after I eat. Only drink with water, only drink with milk, so on and so forth.
That's right.
You know what I mean?
And Ebony, I would even say as a patient, right? And as a healthcare executive, my answer is still the same. You want to get a referral from a family member, a trusted friend, for the doctors that you're seeking, the doctors and health providers that you're seeking. And then get your health insurance based on that. Because we're not getting health insurance and then finding out what fits into the box of our health insurance.
Yes, that's a good point.
Because I'll tell you what, my health practitioners, the people that are on my healthcare dream team, are worth every penny I give them. I pay them for their services. I'm not giving them anything. I'm paying for services. And I'll tell you, Ebony, nurse practitioner Ebony McCoy-Staten, is on my healthcare dream team. And I'm telling you, the knowledge and the care, because in America, we don't have a shortage of healthcare.
No.
You can find healthcare. There's on every corner.
That's what we're right saying.
We have a shortage of care.
That's it.
And if you find health practitioners that care about you and your family and will treat you like family, take my money. because you're worth it.
Exactly.
Because I've been, and you've been, and I have been to doctors and healthcare facilities where you walk in and you know they don't care about you. It's palpable. It's, you can feel it. You're literally just a number. I've sat and you've sat in emergency rooms and at doctor's visits, and you're sitting there and nobody checks on you. You could go to sleep and wake up and still be there, and they wouldn't even bat an eye.
Correct.
And so, yes, if you get an x-ray, if you get a screening, if you go for a pap smear or a mammogram, you want somebody to sit down and talk to you about those results.
And I don't know if you've experienced this, but I've worked with clients where they've mentioned, you know, hey, I had an x-ray done and nobody's gone over it with me. Or I have to ask, you know, you had an MRI done at this time.
Yeah.
Has anyone reviewed this with you? No, they never got back with me with the results. You don't want to continue to work with a provider who's not going to get back with you, even if they don't find anything. You still want your provider to get back with you about what tests you were sent out for.
That's right.
It can leave people very worried. It can create anxiety.
That's right.
You know, just uncertainty about, hey, I was sent for this test and I don't have any results and I don't know what's going on with my health. I still don't feel good and nobody's gotten back with me.
And let's go back to health insurance, because a lot of times when you go into a health facility for a scheduled test, a scheduled visit, if you need a follow-up or anything, like sometimes your policy will require you to get a referral from your primary care to get a mammogram or to have an MRI or something like that. There are requirements that you have to follow. And there are, and before you go ahead and go to those doctor's appointments, those papers or those things need to be faxed over. So, ask those questions. If you require something, a visit, ask, is there anything you need from my health insurance? Are there any prior authorizations that are required? Ask those questions so that you're not refused care or get a bill that you didn't anticipate as a result of, you know, those documents not being
and then have another visit based on what you didn't have in your first visit.
Yes.
So it's slowing down.
It's slowing down. And so if you have something, if you have a condition like diabetes or cancer, that time is of the essence, right? A lot of times your health insurance won't cover 2 reasons for visit on the same day. So if I go in, I need an exam with my OBGYN, but I also need an ultrasound on my stomach. I can't, my insurance won't pay for both of those. So my doctor is going to make me schedule 2 visits. So you know what I do, right? You know what I do.
What you going to do?
I say, do you have time to do both? Because I can pay for one out of pocket. That's where that health savings account comes in.
Yeah, I like that.
Because I know my net worth and I know how much each hour of the day, how much value I possess each hour of the day. I don't have time to schedule another appointment. I don't have time to take off another meeting off. I want to get this done today. So my time is more valuable if I can get both of those done today. I'll go ahead and pay the $100 because when I go back into the marketplace, I can make that back 10 times. That 1 hour. So a lot of times we think, oh, yeah, I want my health insurance to pay for it. But how much is it going to cost you if you have to take, you know, a half a day off of work? So that's why I say your health insurance is only a portion of what you should be investing in your health care. And I say that almost wincing in pain because I know how much health insurance costs. It is inflated. And it has become more so because unfortunately, it is a for-profit industry. Okay, we're talking about multi-billion-dollar industry in our country, and it's not going away. So we have to, as a consumer, we have to equip ourselves with knowledge and understanding so that we can make better informed choices about our health care. And yes, my advice would be to purchase health insurance that's smart, ask the right questions so that you can get a policy that works for you, but maybe a little bit cheaper, and invest some of those dollars into a health savings account that you can use for what matters for for your health and well-being that's not going to be covered by major medical health insurance.
Yeah, I think all of that is so good. So good. Do you think we missed anything with defining health literacy? I think we pretty much kind of covered it.
Keep asking questions. If you have a doctor, a physical therapist, nurse practitioner, a person who works in healthcare in your sphere of influence, call them. Get off of social media, give them a call,
Yes.
say, hey, can I schedule a call with you? I have some questions and I just want to get some clarity on some things. Ask questions. I'm a firm believer that a lot of times you have what you need right in front of you. You just got to tap into it. And so keep asking questions. I get calls all the time. I am not perfect in my knowledge and understanding. I'm always growing and I'm always asking questions of people that are smarter than me and have different areas of expertise than me because I want to grow my understanding. And so I would say do that. Ask questions of people. Don't be afraid to ask questions of your doctors, right? What does this phrase actually mean? How does that apply to me? What are my next steps going to be? And then, make decisions from there. But just keep asking questions, and you can tell the people that really care about you because they won't mind your questions.
They won't. That was the other point that I was going to bring up behind what you're saying. People like, I don't want to inconvenience them or I don't want to bother them. It's going to be more of a bother when you are severely sick.
That's right.
For you.
Yeah.
And your family. Just ask the question.
That's right.
And sometimes I don't know the answer,
right.
but I can find it out. I know somebody that knows somebody that knows somebody that can get you the answer. So I definitely agree with that. Also, too, I just want to add something to that point. If a provider or someone that you know that is in the healthcare field has time, see if they can go with you to an appointment.
Yeah.
So
Absolutely.
that you have that extra set of ears. The practice that I was with, we would ask for their spouse to come.
Yeah.
And I don't know if you guys do that at your practice, but, the information that you're receiving can be very heavy.
Yeah.
And you can just totally go off and just hear womp, 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 womp. But if you've got that extra set of ears, that extra brain, they can ask questions that you're not thinking about. They can understand concepts that you may not be understanding at the moment. They can explain things. And so see if someone can go with you to your healthcare appointments to help support you during such a crucial time.
Yeah.
And ask those questions as well.
It is definitely good to have a partner in your healthcare journey. A lot of things you may have to step out on your own and just go for it. In particular for me, I had to step out there for healthcare regimen, eating better, things like that. Some things you're going to have to do on your own, but you're right. For those health appointments where you're going to be getting a lot of information, it's good to have someone there to help you take notes, ask questions. That way, when y'all get home and you talk about it, anything that you may have missed, they can fill in some of those gaps and you have somebody to go through the journey with.
Yes. Yeah. So that way they understand, like, hey, because I have these frequent appointments, I might not be able to cook dinner. I might need some support in this area or picking up the kids, or, I may be able to make the Saturday game, but I can't make the Wednesday game because I've got an appointment. And so y'all can work as a team,
that's right.
As well. So I just want to thank you so much for coming on and diving into a topic that I'm passionate about, that I know that you're passionate about. And I'm hoping that you guys got a lot from this time. And you can always, once we have uploaded things, you can leave a comment and you can share your experience. And if it's something that I need to address or you would like me to address, I can address it then and there. Joyce, how can they learn more about Dare to Live Well? What are your handles, your social media handles that you would like, my family to know about?
Oh, boy. So if you want to connect with me, I am on Instagram at Dr. Jazzy Joyce. Okay. But if you want to learn more about Dare to Live Well, which is an international movement for health and well-being, we're talking about the ultimate guide to building generational health, go to daretolivewell.com. And you can pick up, this is a brand new book that was just released this year. It is the ultimate guide for building generational health. As we all know, our health is our most valuable piece of wealth. And so daretolivewell.com to pick up that book. It's also available on Amazon and on Barnes and Noble.
Okay.
But that's how you would reach me. I am so looking forward to dive in more deeply into Candid Convos with Nurse E. This has been an incredible journey. Just watching some of this content, it is so important. And so hopefully something that we've shared today has been valuable to your audience.
Yes, it has. It's been valuable to me. So I end every, episode with, we are fearfully and we are wonderfully made, you guys. And we have a plan and we have a purpose. And so in gathering and listening to this information, I hope that it can drive you into the direction of the purpose that God has for you. I want you guys to have a great day, and I will see you guys on the next episode. Bye.